warmer. All right, now to the health beat. This is the season of viral illnesses, and for parents, when we're sick and when our kids are sick, a lot of times we go to the doctor and there's a consideration for taking an X-ray. So joining us this noon to discuss whether or not this is really necessary is Dr. Marc Underhill. He's back from Northwest Radiology. Thank you so much for joining us.
Good to be back.
So we were talking a little bit in the break about some of the most common illnesses that kids are coming up with that raises the question of whether or not we should be getting an X-ray. So what are we seeing right now in your practice?
In the cold winter months, in which it is cold, we see a lot of bronchitis and bronchiolitis. These are your small little airways out in the lungs, become inflamed with viral illnesses. And they are viral illnesses. And the diagnosis of these are clinical. There's a characteristic wheeze, and they do not need a chest X-ray the vast majority of the time. The American Academy of Pediatrics say they only need them when they're being admitted to the ICU or if there's another major complication.
But you can get sick. I mean, this can lead to hospitalizations, and it can lead to other illnesses like RSV and things that are more complicated.
It can. RSV is the most common virus to cause this, and in the United States, children under the age of 1 year old are most likely to be admitted to the hospital with a bronchiolitis. So
are X-rays necessary to make this diagnosis, or are they recommended?
They're not necessary, and they're not recommended, only when there's a complication.
We have a radiologist here saying that maybe
do not employ our services.
Why is that?
There are two big problems and then a third little caveat. I'm not really sure how it ties in. One, this is a lot of X-rays. This is going to drive up healthcare costs. Plus, the second one, and probably the most important, little children, especially under the age of 2 years old, are more susceptible to radiation than you and I. The third caveat they found in the study when they looked at it was most children that get this unnecessary chest X-ray are most likely to be prescribed antibiotics, which are going to do nothing for a viral illness and just create those superbugs that are resistant.
Do you find that a lot of times it's the parents that are scared and they say, you know, forget about the cost, I just want to make sure that we're checking all the boxes, and there's a push for the healthcare provider to do something, to order a test, to order a prescription?
I think there definitely is that pressure from it. A lot of places, the biggest percentage where these are being ordered are places that are not necessarily specialized in children. They deal with kind of everything. So the specialized places are a little bit more comfortable saying, no, this is how we're going to proceed, and that's how we proceed.
What is Image Gently?
Image Gently. It was from the American College of Radiology. There's Image Wisely, Image Gently. It is to do the appropriate radiation test or CAT scan or X-ray. As low as radiation as can be achieved to get the diagnosis.
All right, thank you, Dr. Marc Underhill, for joining us from Northwest Radiology. So parents know you panic when you want to go into the doctor, but sometimes that imaging just not necessary, so make sure you do have a conversation about that. As we look live down